All right, thank you, Nick. Well, type 2 diabetes was once a rare disease for children, but the numbers of kids who are living with it is growing now. Dr. Desai with Kansas City University is here for Tuesday Morning Check-In. Good morning to you.
Good morning.
So, what is type 2 diabetes and why is it becoming more common?
Yeah, so basically people that have type 2 diabetes have a hard time processing the sugar that we get from eating foods and having it go from our blood and into our cells. And this is made worse with people who have the disease of obesity. And so as we're seeing obesity rates rise in the US and worldwide, we're also seeing more cases of type 2 diabetes. And recently, because of COVID, a lot of people didn't have access to a gym anymore. They weren't playing sports in school, just sitting around watching the news and becoming less active. So just a quick public service announcement to get your COVID vaccine if you have not already. A lot of docs in rural areas like Missouri are seeing a lot of patients who have not had the vaccine, and a lot of them are teenagers and younger kids who are really critically ill right now.
So what are some of the symptoms that parents should be looking out for?
Yeah, so you might notice that your child says they're thirsty all the time, or they're having to go to the bathroom very frequently. They might say they have blurred vision, or they might say that they're just tired. And on top of that, you might see some changes on their skin. So the back of the neck, the skin there may be darker than the rest of the skin. And the same thing in their armpit region. You might see some darker skin than other parts of their body.
Who should be getting tested for this?
So in addition to those children that have those symptoms we just discussed, if your child is overweight or obese and they have some of the risk factors, then you should get tested. So some of those include having a family member with diabetes, if your mother had diabetes while you were pregnant, if you're a member of a certain racial or ethnic group, if you're African American, Native American, Asian American, Pacific Islander, or Hispanic, or if you're having trouble, not healing your wounds quickly on your skin.
Once someone has type 2 diabetes, can it be reversed or is there no going back?
Well, you can't completely fix the damage to the pancreas, and that's the organ that makes that insulin, but you can definitely prevent or delay the need for medication. And so some steps to do that include just being active. So getting out there, kids need about an hour of exercise a day at least. So just go out to the park or, play with the kid inside if it's too hot outside. Other things are just having healthy eating lifestyle. So just have your child come in the kitchen with you, have them peel some carrots or, help you there and just learn about what foods are good to eat. And you don't want to cut out everything that tastes good to them. So if you love your Dots pretzels, go ahead and have them, but just don't have the whole bag at one time. Limiting screen time to 2 hours a day or less. And then also just getting enough sleep. So between 8 to 10 hours for most children.
All right. Thank you, Dr. Desai. Always a wealth of information.
Yeah, you're welcome. Have a nice week.
You too.